Hi, my name is Marina Borukhovich, and I'm the CEO and founder of YourCoach. In the world of health coaching, we're always working to help our clients become their best selves, while striving to become our best selves along the way. That is why I'm so passionate about health coaching, and that is why my team and I work tirelessly to bring you the best experience possible. Receiving my coaching certification not only inspired me to launch YourCoach, but it helped me become a better version of myself in more ways than I could have ever imagined. That is something I truly needed as I was healing my body and soul throughout my cancer journey. The driving force for me and my team is creating a virtual home for all things health and wellness coaching. For you coaches, we're giving you a home to manage your practice and help your clients become their best versions all in one place. And now we're taking our promises a step further. We now provide additional opportunities for our active coaching community through our employer partnerships. For you progressive employers and leaders, we're matching your hardworking talent with health coaches based on their individual needs and unique health goals. Especially now as work and home lines are being blurred, and if you care more about health and not just healthcare as most of us do, it's time to start investing in what goes on beyond the doctor's office. And that's not all. We're not stopping here. In order to motivate the coaches on our platform to continue developing their skills and to bring the power of health coaching to more people than ever, we're so excited to introduce a revolutionary gamified pricing model that's going to turn the practice management industry on its head. Now, for practicing coaches on our platform, it's possible to bring the cost of the platform down to just $10 a month with unlimited clients and full platform capabilities. We recognize that becoming our best selves is a journey, and we're so grateful to have you on this journey with us. We're confident that through our best version, we can ensure that anyone who wants or needs access to a health coach will have one. Because at the end of the day, we all just want to be happy and healthy humans. Join us on the health coaching revolution.
Good morning or afternoon or evening, wherever you're tuning in. My name is Eugene Borukhovich, and I'm co-founder and COO of YourCoach Health. We are a virtual home for anything and everything health and wellness coaching, and we'll dive deeper into that. And with me today is Dr. Sandra Scheinbaum. It's really a pleasure to have you here to have a little bit of a fireside discussion and demystifying health coaching for those who don't know much about it or want to learn about what is health and wellness coaching, and we'll dive deeper into functional medicine coaching. So maybe just a brief introduction of yourself, and then we'll dive into some discussions around it.
Thank you, Eugene. It is a great pleasure to be here. So my background was as a clinical psychologist for many, many years, close to 40, and I specialized in mind-body medicine and positive psychology, cognitive behavior therapies, integrating those to help people find wellness, always more focused on what's right with them as opposed to what's wrong. And I was attracted to the study of functional medicine and started to dive in there. I was one of the first people to be certified in functional medicine, that first class in 2013. And I had always been a teacher. So before I was a psychologist, I was an educator in special education. I love to teach and spent many years teaching college level courses. And I focused on the process of health coaching early on as this field was just coming into being, because it evolved from humanistic psychotherapy. That was one of the modalities that I had trained in as a psychologist, client-centered as a focus. And so I formed a collaboration with the Institute for Functional Medicine. So they train the doctors and we train the health coaches to be their partners to help people live happier, healthier lives. So I am now the CEO of FMCA, and we're training health coaches around the world.
You know, before, so Marina, the CEO of YourCoach, she became a health coach herself. And for me, also kind of demystifying this profession, you know, I did take only a 9-week course just to understand it. As a COO in this company, I need to at least understand it, what it is. But, you know, I kind of joke around that if I had a penny of saying, oh, health coaching, it's like a fitness professional, right? And so I think it's more important as we're educating people around us to say what it is and define it. And I think the National Board of Health and Wellness Coaches has been leading the way with early adopters and practitioners like yourself. But maybe for our listeners and viewers, you can kind of define what is health and wellness coaching, and then we can go into what it's not and what to not expect, right?
Sure. So, health and wellness coaches are behavior change specialists. They help people get from where they are to where they want to be. And actually, the word coach comes from stagecoach, an actual literal coach that would come to where you are and it would take you to where you want to be. And we can look at the process of coaching similarly. So, coaches help people change, and change is hard to do. And they are that, this is the secret sauce. So this is a process that involves a lot of study. This is something that you just don't pick up on a weekend seminar about motivational interviewing. Coaching is so much more than that. It does have elements of a therapy process, but it is certainly not psychotherapy. And it is totally client-centered. That means that the client is in the driver's seat and the coach listens in a very impartial, non-judgmental way. They don't come in with their own beliefs, their own dogma. They have their beliefs, certainly, how they live their lives and what they would like for that client, but they don't impose it. They don't say, I want you to do this, or you have to do this. That is the approach that doesn't work. This is an approach that involves listening, asking the right kind of questions that is going to help that individual who's with you to just say, they have this aha moment, like, yes, they make that decision to change. And the coach is their support, they're an ally, they're their personal cheerleader. They help them celebrate wins, they can hold them accountable if that's what the client wants as well.
Yeah, and to me, that's the interesting pieces I've been discovering over the number of years now. So we've been running the company for about 2 years or so, and I think every one of us is an individual, right? We're with our own ebbs and flows and our needs. This week I'm in Boston and I'm traveling, and my patterns are different, and so I need somebody to hold me accountable to what my wellness vision is, right? But maybe dive deeper. So I think there's the health and wellness coaching. Let's talk a little bit specifically around functional medicine health coaching. What is that, and how does that differ or complement, a health coach, and maybe any differentiation there, and then we'll go even deeper into that.
Sure. So we created this approach to coaching that is functional medicine health coaching. And the field of functional medicine is first and foremost based on science. It's evidence-based, and it's addressing the root causes of dysfunction. Why do we get sick? It's because there might be some underlying cause that's tying all of our symptoms together, like inflammation, for example. What do we do about it? We would apply diet and lifestyle changes, addressing things like the foods we eat, how much we exercise and move throughout the day, our sleep, our relationships, our relationship to stress, and how we handle stressors. And so functional medicine is practiced by clinicians, by medical doctors. The health coach is the one who can partner with the functional medicine doctor, for example. They can also work on their own and partner with their clients, and they can educate these individuals about the fact that there might be some root causes, there might be some things going on that they would want to take a look at. And the special zone in functional medicine in our approach for the coach is those modifiable lifestyle factors that I just mentioned. And the functional medicine coach would address those first and foremost through the positive psychology approach. And that, again, it's where you look at how can somebody flourish? How can they thrive? How can they use a strengths focus and make those changes to their diet and lifestyle? So it is addressing the root causes through the power of diet and lifestyle change. and then often consulting with a functional medicine practitioner who may be looking at specialty lab results, for example.
So, how do individuals really engage? Because we all have, we're either pre-chronic today or unfortunately in many cases become chronic disease patients, right? Maybe you can talk a little bit about, health and wellness coaching and interfacing that with the healthcare system. I've been kind of saying that, if you rewind all the way back, probably 20 years, maybe a lot of the health and wellness coaching, I kind of joke around a bit. It was considered some, I kind of joke that it's cuckoo voodoo science, but I think the profession has been very much legitimized. And you started off the discussion that it's very much science-based. So maybe first let's talk about those science-based approaches a little deeper and to understand what does that mean for that individual as an experience, and then we connect it back to the healthcare system.
Sure. So the field of functional medicine is based on research. It has its roots in cellular biology, a systems-based approach to analyzing various systems of the body. And what health and wellness coaches, the legitimization has come because, specifically for functional medicine health coaches, they're going to refer to the data. Like, here's what we know, here's the state of the science so far. But what they would not do is go out on a limb to say, everybody must be paleo or everybody must be plant-based. That is a one-size-fits-all approach that is not based on science. Unfortunately, we're still doing this in conventional medicine, like everybody who has an elevated cholesterol reading should be on a statin. Mm-hmm. So that would be one size fits all, like this is the pill that addresses this condition and it's good for everybody. So in functional medicine, we really look at a personalized approach based on genetics, based on toxic load, based on all those diet and lifestyle factors. And then specifically for the field of health and wellness coaching, there have been great strides to legitimize it as a profession. So to just give you some background information, the field of coaching in general, we're talking about all types of coaches, executive coaches, life coaches, came with, if you consider it like a spin-off. It was from humanistic psychotherapy. One of my mentors, Frederick Hudson, was one of the first developers of the concept of coaching. He originally called it the Mid-Career Development Institute. It was for people who don't need therapy. They don't have a diagnosable mental disorder. They just need support. They need to have somebody who is acting as like an athletic coach, who is giving them guidance, feedback, accountability. And out of this field of life coaching evolved over a spin-off, health and wellness coaching. But it's strongly rooted in that tradition. And around 2011 or 12 or so, the leaders at that time in the field were very concerned that there were no standards. People were just hanging out a shingle saying, I'm a health coach, with no training or very minimal training. So they spent many years setting up the National Board for Health and Wellness Coaching, which has the minimal standards that you need to meet. And they have a board certification exam. They approved schools to be eligible, that our graduates can sit for that exam. And fortunately, Functional Medicine Coaching Academy is an approved school. Our graduate sits for the exam. They're a partnership with the American Board of Medical Examiners. So that is bringing us legitimacy. They are also working very diligently with the American Medical Association and CMS and Medicare body that oversees and develops the procedural codes for eventual insurance reimbursement. And that was a big step when we got what's called Category 3 codes. So that means if you are a board certified coach, you can submit a claim. Because it's Category 3, not Category 1, it doesn't mean it's going to be eligible for financial reimbursement, but it's a significant step. The other step for legitimacy was just in April 2021, we got NPI numbers, National Provider Identifiers. Again, major step forward so that this is a legitimate healthcare profession, and it's exploding. I have to say that at post-pandemic, this is one of the most popular, in-demand professions. People are waking up to concern about their health, and so many people are wanting to become health coaches, and there's opportunities for employment as well.
Yeah, and we're witnessing we have almost 2,000 coaches on the platform now, and we're witnessing that a lot of the coaches, and this is back to what a coach is or is not, we're witnessing lots of nurses leaving healthcare, right, and getting their health coaching degrees and kind of saying, well, we can't help patients anymore inside the system, maybe we can help them outside the systems. Many doctors are going back out there, and even though they've practiced medicine for many years, et cetera, going to get their health coaching degrees. And many institutions, right? Yes, you guys are one, but actual colleges and universities are now have health coaching programs, which is, amazing to see that this profession now is graduating young talent to get into this profession and help individuals. Because I think, from a healthcare persistent, we're just talking to somebody else earlier, unfortunately, a doctor has 8 to 10 minutes, if that, with a patient, right? Inside. Maybe we can dive deeper, because every coach that, at least registers in YourCoach, there's a niche, right? And many coaches kind of pick their niche. And maybe you can talk a little bit about, again, for that particular individual or an individual, how do you find a health coach? How do you choose the one with the right niche? What does having a niche, does that mean anything for you as an individual, right? Because again, we have classify, everything from gut health specialist, to heart health, and then a health and wellness coaching kind of across. And then there's a functional medicine view as well of it. So maybe you can talk a little bit about the niches and more, and then at the same time, the holistic care of it all.
Yes, well, I want to just defer to my good friend, JJ Virgin. And she is fond of saying, you narrow down to expand. Many people struggle with the idea of having a niche. They think, well, I want to serve everybody. And I would say most of our graduates are in that category. They are coming to us with a desire to serve. And they want to serve, and they can serve everybody. But how do they really get referrals? How do they stand out? Well, I still remember a conversation I had. Well, she was one of our first graduates. She was in the UK, and she had struggled for many years on pain medications, and she was able to successfully withdraw. So she was very passionate about serving this community, helping them connect with the right practitioners, supporting them through this process of withdrawal, if that was their choice. And so I associate her with the specialty. Similarly, we have somebody, she's one of our co-moderators on Clubhouse, the new social media platform, and she stands out, and she's creating rooms because she specializes in women's hair loss. And so somebody is a doctor and they've got a patient and they're dealing with this condition, and they might think, oh, Tara, yes, she would be a great coach to connect with this individual. Also, that when you establish your specialty, it's not written in stone. It doesn't mean just because you specialize in autoimmune or one facet of an autoimmune condition that you cannot help anybody else. It just means that this will be your identifier in the marketplace. It offers wonderful opportunity to collaborate with others who are in this space. And so we recommend it, but sometimes if you're just starting out, it can be overwhelming to choose. And so you could be a generalist for a while, and then sometimes that specialization will evolve for you. But it is something that can help you identify yourself. When someone says, what do you do? And then you can say, I help people who with this, this, and this, and that
Yep.
can be very, very impactful for the listener.
And us as individuals, again, and I mentioned this earlier, we kind of ebb and flow, and as we go through our life and health journeys, we have different needs at different times, right? Or different suspicions or different goals. And I think, to me, that's actually a beauty of kind of health and wellness coaches with those niches, and finding the right coach for you at that right time. And also from a scope of practice perspective, right? Those exact coaches know when they need to stop and refer with some others. So that I wanted to sort of touch on that.
Absolutely.
Maybe we can switch gears a little bit, right? Because we're also, I mean, as your coach, first and foremost, we are providing a full platform for coaches to manage their business. We have been building an amazing community of coaches around it, sharing, right? There's a lot to share as this profession grows. And then finally, we are going to, individuals as well as small and medium-sized businesses to really provide their talent health and wellness coaching services, right, in a very dynamic manner. Maybe we can talk a little bit about, because at an individual level, I think we've talked quite a bit about this now, but because you said something interesting earlier, that health and wellness coaching is kind of a spin-off of a life and executive coaching, right? And we're sort of approaching this: if individuals are happy and healthy, they will have the energy and the performance, right, to actually perform on an everyday basis, whether it's for work or with their friends and family. Maybe you can touch a little bit about, what does that even mean to get a health and wellness coaching for a team, or for a small employer to help their teams, right, to be the best they can be. So any experiences or any thoughts for our listeners and viewers on that?
Yes, definitely. Well, you mentioned something really important that says it all: to be the best they can be. So you want your employees to have energy. You want them to be able to be productive, to support one another. You want them to stay well. You don't want them to be missing work, to be suffering from the kinds of chronic conditions that are going to then down the road lead to even more severe conditions and consequences. So type 2 diabetes, for example, is just an epidemic. People are having cognitive decline, mild cognitive decline, which can mean brain fog. They go out and eat a heavy lunch, processed food, and then they want to take a nap. Well, how are they contributing to the success of your business if that is happening to your workforce? And we have many people who are on the job and they're present. They're not calling in sick, but they're just going through the motion. And of course, now as so many people are working remotely, again, concentration, being able to be fully engaged with your work, with all of the things that might be also going on in your home environment. So self-care, when you are a company that is concerned about the wellness of your team, then that team becomes so committed to your mission. And you want people who are committed, who are passionate about the mission of the company. And when you have a health and wellness coach, they buy into those values that are your company values and your mission. And so they will connect with people. Well, what is key is that the kind of wellness programs that we had years ago often didn't work. Now, you can't be forcing somebody to start an exercise program or some of the games, the contests they had, and people they were doing it just to please the boss, but their heart wasn't in it. The role of the coach is to have to really connect with people and find out, what do they want their future self to look like? What's their vision? What do they want? What matters most? What do they want their health for? And then they can take these small steps that are manageable so that they can attain these goals. But it starts with their personal vision. And this can be done so well in groups. in even with settings or amongst employees that might be exhausted, burned out. We have a graduate, she used to be a nurse, and she still is a nurse, and she's starting to coach on the side. But one of the first things that she was engaged to do, she started volunteering in her unit with other nurses, gathering them together. They would do some quick breathing techniques, just a way of restoring themselves. And this soon turned into a bigger program where the hospital administrators were
Amazing.
interested in it, and she is now taking her coaching into the environment. We have a lot of graduates who come from like law, for example, or a world of business. They're in corporate or they're running a business, and they train to be a coach, and they know the market. They know what it's like to work in a law firm, for example. So now they specialize in helping people in this area. And the beauty of working in groups is something that can be done just so well, again, in small or larger companies. So we also have companies who send people through the program.
Yep.
So that they are dedicated to meeting the needs of the company, and they know that company inside out.
Yeah, and it's interesting, right? Because I think as the company grows, and whether you have 100 employees, but I think somebody, a chief people officer, we've seen a trend also going for their health and wellness coaching certifications to understand what it is. It doesn't mean that they need to practice it on a daily basis, but I'm sure it also helps manage and the talent and have those discussions and conversations. So that's a perfect end to our discussion. And maybe just if you have any kind of closing thoughts, and maybe on FMCA, would love to hear them.
Sure. So it is all about community, and the importance, whether you are an employer, you want a well community. And so when you have a health coach on your team, everybody benefits. When you're a doctor, you bring on a health coach, it's reducing physician burnout. There's research on this. Allied professional staff are helped as well. And Functional Medicine Coaching Academy, we train people from all walks of life, all ages. We have, you mentioned medical doctors, so we have a lot of medical doctors. We are a collaboration with the Institute for Functional Medicine, so we work closely with them. Our content is their content, just modified for coaches. And I'm super excited about the field. So we are functionalmedicinecoaching.org if anyone wants more information.
Well, Dr. Sandy, thank you very much for enlightening us and our listeners and participants. And we're looking forward to further cooperation with FMCA. Thank you so much.
Thank you. It's been a pleasure and an honor to be here and talk with you.
Hello. As you can see, I was able to change my shirt due to some scheduling conflicts. We actually pre-recorded this discussion with Dr. Sandy earlier. I wanted to address some questions that came up through this. So thank you very much for all joining, either morning, afternoon, or evening, depending where you are in the world. Let's just get through a couple of questions here. So the first question that we saw was, what do you foresee as some of the biggest trends in corporate wellness, and where does health coaching fit in? So obviously we're in the market, and what we're hearing from small and large employers, there's a lot of confusion on tools, services, and we do foresee some consolidation in the space. And for us, where we're approaching this from a small and medium-sized business, especially, I think part of what we're seeing is also, we do believe in health coach-led environment for corporate wellness, as Dr. Sandy talked about earlier, around really focusing in on that human nature and human being, and understanding your goals is what the key component of that is. The other aspect to this, and something that we're also seeing, I think, if we look at health coaching, it's traditionally has been available to executives, and I think this is getting much more democratized now. not just with YourCoach and our services and our network, professional network of health and wellness coaches around U.S. and abroad. So that's a little bit of an update for that. Let's see, what's another one? Okay. So how long would a typical employee work with their health coach? Do they have an option to be matched with another health coach who specializes in something different if another issue arises? So my first comment, it's not about issues. I think part of that is actually helping individuals understand their goals and helping them achieve their goals. So it's not about issues. We, from a YourCoach perspective, we start off with a minimum of a baseline of 3 months. But of course, as we all know, this is a relationship that you need to build with that individual that can help you on your journey. And therefore, actually, our Hito sign is a Japanese character for a person, so somebody you can lean on. So that's us. Okay. Next one. What are the benefits of having a health coach over other digital tools? So, first of all, a health coach is also a human being. There are a number of tools and platforms out there that are AI coaches, and we do see them on the spectrum, and I think it all depends on that individual. On the spectrum, you can be motivated intrinsically, ready to do something, and that AI health coach can help you. What we're doing, we very much believe in helping individuals in a health coach-led model. And we do have partnerships with digital therapeutics, self-paced, non-prescription digital therapeutics and tools such as HealthTunes, Happify, Click Therapeutics with Clicatine for cessation of smoking, and others are coming into that toolbox for health coaches to work with you as an individual and to help you achieve your goals, whatever they may be. And similar, we talked quite a lot with Dr. Sandy on the time spent with a doctor and outside where health coaches can come in. We would also say that to a certain extent, health coaches' time is also limited. So it depends on, what can you be self-paced with cognitive behavioral therapies and other non-prescription digital therapies and tools. Another one, a little bit more on the privacy side, is there a way to have a personalized assessment of each employee? So we do respect the privacy of every individual, and even though we are working with employers, all of that information going back to the employers is de-identified as an employee. You can actually choose to choose a nickname. So you would get a code as far as your company is concerned to sign into YourCoach and start working. You get assigned a health concierge. And then after the initial assessment, you get assigned a dedicated coach to you and your needs. However, again, all of that information is private between you and that concierge and the coach. And we do keep that de-identified from an employer perspective. Let's see. How long, I think that we touched a little bit on this, how long should you work with a health coach? It's a relationship, right? And I think as we talked with Dr. Sandy earlier, all human beings, all of us go through ebbs and flows and ups and downs and certain goals that we want to achieve throughout that process. And so it's an ongoing relationship. And we, by the way, also may need different coaches at different points in our life, right? And depending on where we are, both in personal, professional, and even clinical, medical reasons. So with that, trying to see if there's a few questions that came in for Dr. Sandy, and then we'll address them. Obviously, she's not on with us, but a lot of them were more around back to the trend. Yeah, so we kind of touched on this a little bit, and this is related to FMCA, Functional Medicine Coaching Academy, where Dr. Sandy is the founder and CEO of. Also on the corporate wellness, we did touch on this a little bit. We are seeing HR and benefit managers, chief people officers are going through training such as FMCA, Dr. Sears, and many others. Again, probably more so to understand what it is because it's got its roots in life coaching as well. With that, we are gonna end this webinar. So thank you very much to all for attending and hanging in with us, and we will see you next time.